Hello, my name is Audrey Dugan and I am a medical student at Mercer University School of Medicine. Nearly 20 million U.S. adults are living with persistent or major depressive disorder, and nearly 40 million U.S. adults are living with an anxiety disorder. However, only a small fraction of those who have a diagnosable mental illness are receiving medical or therapeutic care. One of the biggest barriers to entry for mental health diagnoses is recognizing signs and symptoms. In this video, I hope to share some of the common and less well-known signs and symptoms of anxiety and depressive disorders to look for in your friends and loved ones. Anxiety is a general term for a family of diseases. The following are some warning signs for 3 of the major types of anxiety disorder. Generalized anxiety disorder is persistent and excessive worry that interferes with daily living and may include physical symptoms, including restlessness, easy fatigability, difficulty concentrating, feeling on edge, trouble sleeping, and muscle tension. Panic disorder involves recurrent panic attacks with a combination of the following psychological and physical stressors, including trembling, pounding or rapid heart rate, shaking, shortness of breath, chest pain, lightheadedness or dizziness, feelings of choking, numbness or tingling, chills or hot flashes, nausea or abdominal pains, feeling detached, feeling of losing control, and fear of dying. People with social anxiety disorder have extreme discomfort about being embarrassed, humiliated, looked down upon, or rejected in public, and may experience some of the following: extreme fear of public speaking, difficulty eating or drinking in a public place, fear of meeting new people, and avoidance of certain situations. This is not an exhaustive list of all anxiety disorders, but these are 3 of the most common to look out for signs and symptoms-wise in your friends and loved ones. Depression can often be harder to recognize in a friend or loved one due to the varied presentations. Here are some of the common and not so common signs and symptoms: feelings of sadness, decreased interest in activities that were once enjoyed, weight gain or weight loss, changes in appetite, increased fatigue or decreased energy, changes in sleep, including increased sleep or insomnia or inability to sleep, increase in purposeless movements, difficulty thinking, concentrating, or making decisions, feeling of heavy limbs, or thoughts of hurting themselves. If you notice any of these changes or signs or symptoms in a friend or loved one, please reach out to your primary care physician or to a mental health professional as soon as possible. If your friend or family member is having thoughts of hurting themselves or someone else, please take them to the nearest emergency room or dial 911. There's also a suicide prevention hotline that's available 24/7 at 800-273-8255. For further information on psychiatric disorders and psychiatric diagnoses or signs and symptoms of other anxiety disorders and other disorders of mental health, you may visit psychiatry.org. I hope that this video has been informative.